This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
It's
Supposed to
second.
help us or
Medical Dilemma.
Hi, I'm Sonny Del Rosario and you're watching Medical Dilemma. The thyroid plays a major part in metabolism, growth, and maturation. Despite this significant role, few know where the thyroid is, much less what it does. In this episode, we will rediscover the thyroid gland and understand how it contributes to the development of the human body. Our guest for the first segment is Dr. Alfredo Pontejos Jr., otolaryngologist and head and neck surgery specialist, connected with Manila Doctors Hospital and the Philippine General Hospital. Welcome to the show, Dr. Pontejos.
Yes, magandang gabi, Sunny. Yes. Good afternoon to the audience.
Yes, thank you so much for joining us in today's show. Now, Dr. Pontejos, let's first talk about your specialty. What is an otolaryngologist?
Okay. The otolaryngologist is basically an ear, nose, and throat surgeon, but also includes the head and neck. So when we say ear, nose, and throat, we deal with the diseases of the ear, the nose, and throat, to include the larynx, so the voice. And then on top of that, we also do particularly cancers and tumors of the head and the neck, except the brain and that of the eye.
Except the brain and the eyes.
Yes, because the eye is the ophthalmologist,
Yes.
the brain is the neurosurgeon.
So it's practically the whole head,
Yes,
from
and
the
neck,
base
yeah.
of the neck up.
Yes.
Okay. What are the typical cases that you encounter as a practitioner?
Okay,
of
as a practitioner, we normally encounter ear diseases like otitis media or infections of the ear. We also deal with nose, like allergic rhinitis,
Okay.
mga hatching-hatching, and that of nasal polyps. And then we also deal with laryngitis and nodules. And of course, among the tumors of the head and neck, we also deal with tumors of the throat, the oral cavity, the nose, and also the thyroid. Thyroid being number one in the list. In fact, if you look at the list of the top, well, talking about malignancy, top 10 malignancies, thyroid is ranked number 7.
Number 7.
On top of that, the non-malignant is really a lot. It's endemic in the Philippines.
I see. So these conditions are prevalent among Filipinos especially,
Yes.
compared to the rest of the world.
Compared to other countries, I think we have one of the most number of diseases, tumors in the thyroid.
In the thyroid.
Yes.
Okay. Now, what exactly does the thyroid do for the human body?
Okay, the thyroid actually is it's a master gland that controls the activity of the body. So it, yes, you mentioned, controls the metabolism, okay, of the body, and it controls our maturation too. And so, if, for example, you are hyperthyroid, so that means if your thyroid is hyperactive, then what happens? You're a little bit giddy, you're a little bit hypersensitive, and you sweat a lot, you perspire, you tend to your pulse rate increases, and then you're hyperactive. Whereas if your thyroid is not too active, meaning hypothyroid, then it's the opposite. You tend to be lazy, you don't easily sweat, okay, and you have a
You don't like
tendency
moving
to
too much?
Yes, you have a tendency to grow fat. See, so it is like it controls all the activities of the body. That's the basic function,
That's the function
of the thyroid.
Okay, and where exactly is this found?
Okay, the thyroid is right there in the neck, in the middle portion of the neck. Okay, so if you swallow, you would feel a little bulge here, and that would be the thyroid. That's left and right. So you have a thyroid in the midline, and it has
Yes.
two lobes. Yeah.
Okay. How would an ordinary person know if there is something wrong with his or her thyroid?
Okay, we've mentioned some of the symptoms. If you're hyper, we have mentioned that already, and if you have hypo. Now, there's what you call a normoactive thyroid, meaning the functions are okay, but you develop something like a bukol, you know, or a tumor in the, or a nodule in the thyroid. When you start to palpate something there and there's a little bit of a hard bulge, then you have a problem with your thyroid.
But is it always a malignant condition?
No.
No.
All the tumors in the thyroid, around 20% would be malignant.
20%.
80% would not be malignant.
Now, if you're able to detect early the tumor's
Yes.
condition, what is the what do we say? How do we say it? The survival rate?
Oh, okay, okay. Talking first about the benign lesions. Of course, benign lesions are okay. You see them walking around with big, what we call bosho, you know, with big
okay,
thyroids.
so-
They are benign, and yet they could continue to grow, you know, and they will not cause harm or death to the patient, except when it grows inwards, causing obstruction of the airway. As you know, it's sitting right on top of the thyroid gland and the trachea, and those structures is also part of the airway. So the
Okay.
moment it impinges on it, so you might get choked, even if it's benign. I just did one just 2 weeks ago, where the thyroid was very big, and it was choking the patient. In fact, it has compressed on the trachea. So if we didn't remove it, maybe the patient could die of choking. See, of course, the other 20%, which are malignant, of all the malignancies, this is the kind of malignancy that is rather compatible with life. Okay?
Compatible with life?
Yes, particularly the papillary type of CA. Although a small percentage of papillary would be aggressive, but this is more the exception rather than the rule.
I see. So which means even if you get a malignant tumor,
If it's papillary,
yes,
if it's papillary, because there are 4 types. You have the papillary, you have the follicular, you have the medullary, and you have the anaplastic. If it's anaplastic, then I say goodbye to you.
goodbye.
Yeah, because it's very aggressive, and it just grows very fast, it spreads very fast, and on the average, they just survive in around 6 months.
Just 6 months from the
Yes.
time of detection.
Yes, yes. The medullary is a different kind of a disease, but the more common would be papillary and follicular. If you have these two, the survival is relatively okay.
Now, what causes the thyroid to enlarge itself or to inflame?
Okay, well, in general, if you're talking about the benign lesions, lack of iodine intake
Lack
could
of
be one
iodine.
of the causes of enlargement of the thyroid. Now, the other factors could be genetic, the other factors could be exposure to some things like radiation, okay, which can cause you to develop malignancy.
Okay, now supposing a patient has been diagnosed to have a thyroid with a certain condition, how would you go about treating the
Okay,
condition?
the first thing is, of course, you do a good history and physical examination. From there, you'd pick up a lot of things, and 80% of the time, you'd be able to have a proper diagnosis. And if it's just general enlargement, sometimes what we do is we just treat them with thyroid hormone itself. Okay, it's a little bit complicated. It's an indirect way of treating it. You give thyroid hormone, so you have a feedback, and so you have what we call the TSH, thyroid stimulating hormone, will lessen production, so the thyroid will get small. This is for benign. Now, if it is malignant, so for example, when I palpated for the neck, it turns out that you have a nodule, then we suspect 20% of the time it might be malignant, so we have
Okay.
to do something about it. First thing we do is we do ultrasonography.
Okay.
It's ultrasound, not very expensive. So that they will tell us what kind of tumor this is, whether it's a cystic one or a solid one. When it's solid, we're a little bit worried. When it is combined, we're also a little bit worried. And so if it's solid, then we tend to do what we call a fine needle aspiration biopsy. It's a
Okay.
simple test, well, a little bit expensive now, cost around 4,000 to 5,000. You use a small needle, you puncture through the tumor,
Okay.
and then you aspirate a small amount of
Tissue sample.
yes,
Yes.
cells actually, and then a good cytologist will read to you what it is, and it tells you whether it's malignant or not.
Okay. If it's malignant, I suppose you really have to take it out through surgery.
Yeah, controversial. Okay, there are some groups who would say if it's small, like 1 centimeter,
Yes.
malignant, we can still observe. So you just go on a regular checkup.
Okay.
If it doesn't grow, that's fine. But of course, a patient in general, when they know it is malignant, they want to have it out. Okay. So most of the time, we do end up removing it. Again, controversy, whether you have to remove all the thyroid or whether you have to remove just one
Just
lobe.
part, yes.
Yeah, just part of it. The minimum, of course, would be lobectomy, meaning you remove one side.
One side.
When you
Okay.
say total, you remove both.
Both, yes.
So when do we do lobectomy? Normally, if it's 1 centimeter or less, and you don't have any involvement of the other side. At this point in time, that's the only indication for lobectomy. The rest will have to undergo total.
I see. And what's the greatest risk connected
Yes,
to surgery?
That's good. 2 risks. One is the recurrent laryngeal nerve, because the nerve that supplies the voice box, is right there, and it's closely attached to the thyroid.
Okay.
So if a surgeon inadvertently cuts it, then obviously you'll have hoarseness. Worst scenario is you've cut both, then the
Okay.
patient will not be able to breathe.
So you lose the voice.
No, you can have the voice, but you will not be able to breathe because the vocal cords will now close.
Ah,
Okay.
I see.
So that's a problem. Now the other thing is the parathyroids. Apart from the thyroid, you have parathyroid hormones, which are on the sides of the thyroid. What does it do? Now it controls your calcium metabolism. So the moment you remove it, you could have hypocalcemia. What is hypocalcemia? If you lack calcium, then you have like tetanus. Okay, you have stiffening, you can have difficulty of breathing, and you can have twitching. So this is another problem, and this is also a bad situation. So
Okay.
when we do surgery, we take care of the recurrent nerve, and we take care of the parathyroid hormones.
Okay, thank you, doctor. We'll have to pause here first.
okay.
We'll take a commercial break. Don't leave this channel. We'll be right back after a few words from our sponsors.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Why when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?
Like, there are other facets of it. So you hear it, you see it, and then you can smell the fireworks.
Now put it quickly by asking where we're the
Unique word here what needs to be Okay?